But as Jim mentioned, I'm Angela Odoms-Young. I'm a faculty member in kinesiology and nutrition. And a lot of the work we do is in partnership with communities. I was really excited to see the film because the idea is that communities have a voice. A lot of people want to talk about this issue of food access, but it's really the people that live in the communities that are the experts. I am sort of both a community resident in a low access area as well as a researcher that's interested in thinking about these issues in connection with communities. And this work was done in collaboration with the Chicago Department of Public Health, Inglewood Neighborhood Health Center, as well as some other partners in Inglewood, a Teamwork Inglewood, among others. So what's the challenge? This is the Illinois Public Health Association meeting. There's been a huge discussion about obesity, particularly in communities of color. Obesity among African American adults, particularly women, is quite high. Also, you see the same pattern among African American girls, and it appears that obesity has been rising more steeply in African American children compared to other ethnic groups. And it's been well documented over the last several decades about poor diets, including low intake of fruits and vegetables, whole grains, lean meats, in communities of color, but of course in the U.S. overall. So traditionally, where we've taken an individual approach and really focused at the bottom of this ecological paradigm, now we sort of flipped it on its head, and now we're talking about societal approaches. The problem with that is most of us are trained as behavioral scientists in thinking about individual approaches. So when we talk about the issues of food access, partly we don't have the models, the theoretical basis to really think about what do we do in these communities. So people are trying to develop models and approaches to figure out how do we change policy, how do we change society. Of course, when I started in nutrition, very few people were talking about addressing agricultural subsidies to look at combating chronic disease. That's something that's happened over the last probably 10 years. So one of the issues about thinking, one of the ways to think about food access is really to move away from the individual level to think about social determinants of health. How do economic and social conditions influence the health of individuals, communities, and jurisdictions as a whole? Social determinants of health are about the quantity and quality of a variety of resources that a society makes available to its members. And even though we've started talking about food access or food deserts, one of the things that I wanted to discuss today is how do we move even beyond that conversation to think about social determinants of health as they discussed in the film. So what is an equitable and accessible food system that actually supports health? Supports health of African American populations that are disproportionately at risk for nutrition-related chronic diseases, low-income populations, and really understand this perspective from a community voice, from a community perspective. This work that I'm going to present today was done in part of a larger collaboration from the African American Collaborative Obesity Research Network, which is a collaboration of both researchers, community members, public health professionals. And these studies have focused specifically on characterizing perceptions of neighborhood food and marketing environments in African American communities, one, to increase demand. There are 4 sites: University of Alabama at Birmingham, UIC, Duke, and University of Maryland. And the idea is, how do we have this ongoing local mobilization of African American communities, and how can researchers play a role in that? And it also includes some research dissemination activities to researchers so they can better understand why this particular issue is important. The African American Collaborative Obesity Research Network includes more junior scholars as well as community partners. And the mission is to improve the quality, quantity, and effective translation of research to address weight-related issues in African American communities. So I know this is sort of hard to see, and I'm going to walk over. So part of what we've been thinking about, can you hear me? Okay, is so to not only what's happening currently, but also thinking about historical and social factors. Even though we've talked about food deserts in only the last few years, to many people that's not new that grew up in those communities, because the idea is that there's a historical perspective on how environment shapes food access. So this is focused on African Americans, but of course it could apply broadly. So what is our history? How does it affect the way we live? What kind of social institutions do we have? What kind of social values do we have? And then environments, which has been the predominant focus, and at least of this meeting. Do we have money to buy the things that we need? What are our neighborhoods like? What type of food is available? How much does it cost? What kind of opportunities do we have for recreation? And then what kind of marketing environments do we live in? So this sort of community-centered paradigm has been what's guided the work of ACORN, or the African American Collaborative Obesity Research Network. So in this particular study that I'm going to discuss briefly today, and draw on a report that we just released called When We Have Better, We Can Do Better, it was really to apply the social determinants of health and look at it in the context of the Inglewood community and food access. We focused on families with children 0 to 6. We conducted 2 semi-structured interviews, which also included a photo elicitation where we gave families cameras and asked them to take a picture of their typical day. What is it like living in the community? What is your life like as you go through your community on a day-to-day, on a daily basis? And also, what do you see as far as food in your community? We were interested in families with young children because we know that early intervention is key. We recruited from WIC, Healthy Start, case management programs at Inglewood Neighborhood Health Center. The interviews were transcribed verbatim, and then we used constant comparative analysis. And this I'll just touch on briefly for the sake of time, but we included both parents as well as grandparents that were raising grandchildren. Most of the participants were female. The majority lived in Inglewood and West Inglewood. About 73% had higher than a high school education. A large percent were married, primarily low income. 63% received food assistance, and about 26% received cash assistance. So in thinking about the social determinants of health related to the food system, I would like to talk about the economics, the employment, transportation, perceived racism, and violence. And so these were things that came out of the interviews that were discussed within the context of the interviews as well as the photos. So as far as economics, family economics and community availability of resources played a key role in shaping food access, as well as dietary behaviors. And I just have some examples from the transcripts with families. One of the participants said, that first choice may be more nutritious per se, but it goes nowadays with the economy being as bad as it is. I ain't thinking about all this quality stuff. I'm thinking about surviving for the long haul because my money is funny. So economics play a key role. When we think about food systems, we need to really think about affordability. Employment was also, when you think about the social determinants of health, the lack of employment opportunities within the community. And it's very interesting because many of the people that worked outside of the community in food-related industries actually had more access. So by leaving the community and working in a food-related industry, traveling out of the community actually provided more access when those businesses could be inside of the community. But lack of employment actually limits access. I drop him off at school, then I go back home and I watch TV. I basically watch TV all the time. I don't have a job, so I pick him up about 3:30 from school. I take him to the store, get him a snack. We come home and we watch TV, and then I fix dinner, and about 6:30 we eat and we go to bed at about 9. That's my typical day. So that's very different than some of the participants that had a variety of access, that access the community, where you had participants because of limited employment opportunities were basically restricted to the community. Transportation was also an issue. And I say restricted because there were other, I shouldn't say restricted because there were some exceptions to that, particularly through social networks and informal networks. But you saw a very different pattern from people that were able to access as far as financially, as well as employment, transportation, etc., outside of the community. So transportation was also an issue. Access to personal resources such as a car, public resources, as well as physical mobility. Because we had grandparents that were raising grandchildren, being physically mobile when we talk about getting from one part of the neighborhood, even if there's a store located 3 blocks away in Inglewood, that may not provide access to somebody that has limited mobility. And there was variable access over time as well as between families. Transportation, that's why a lot of times we go to store A. And most of the stuff at store A, my kids will eat, but my wife won't eat. So she'll go there and get most of the stuff from there because it's in walking distance, and the stuff that we want will wait. We had a car, but it kind of broke down. So we had transportation to get where we was going, but now our car is kind of down. So now we usually go places where we can walk because we like to walk. So we'll try not to get too many bags. If we have to go to store B, we'll get on the bus. She'll carry 2 bags and I'll carry 2 bags. So we're kind of limited getting to our specialty stores. So transportation and cost plays a lot in our decision and how to keep the family happy. Also, transportation related to accessing multiple food items when you had transportation. Because sometimes I used to have to catch the bus or catch a cab in order to get to store C. But now my sister has a car, it's more convenient for me. But at the same time, the food varies. It's just fresh. I love the fact that they care about the food items. They care about their customers and how they eat. I just love store C. So people talked about a variety of varied access over time. When they didn't have a car, now they have a car, or when they had resources and they didn't have resources to be able to access. So transportation is also one of those issues when we think about an equitable food system. Perceived racism was another issue that was raised by participants. The idea that black versus white deserve the same services. To go into other communities and notice that the services were different. And some people talked about this in the context of racism, and some talked about it in the context of racial preferences. As well as the conflict between store owners and community residents was also raised by many residents. Where most participants felt that the conflict was based on store owners' lack of respect for the community, others based it on unruly customers and felt that store owners who have a long history in the neighborhood will help people in the neighborhood, or those that embrace African American culture have a better reputation overall. And this, I think, is an issue that has not been raised very much when we think about store ownership. We talk a lot about the big box, and we talk a lot about different types of solutions, but when we talk about store ownership, primarily the stores owned in African American communities are not owned by people within the communities. And many of the residents talked about that. They may have had positive things to say about it or negative things, but most residents raise that as an issue to be discussed.